Hey, wow. Thank you for the fantastic introduction. I got to tell you, I'm honored. I'm excited. But most of all, I'm pumped up to be a part of the first ever RMS Climb event. And you might ask me, Chris, why are you so pumped up? And the reason I'm pumped up is because when Brad Jones, CEO of RMS, came to me, he said, Chris, I want you to speak about drug nutrient depletion. And I said, that's great, Brad. I would love to do that. Hang on, I got to share my screen. Hang on 1 second. I'm trying to share my screen. I apologize. Technology, right? Sorry about that. Now, when Brad with RMS came to me, he said, Chris, I want you to speak about drug nutrient depletion, and I want you to speak on the C, which stands for care. But Brad didn't stop right there. Brad said, Chris, I want you to understand that it's customer-centric care with drug nutrient depletion. And I was like, there's no other topic I could get more passionate about than customer-centric care and drug nutrient depletion. So I was pretty fired up. At Solutions RX, we are a probiotic, vitamin, supplement, and enzyme company. And we partner with independent pharmacists to solve patient problems. Then you add on to that, I get to speak right after my good friend Patty Mara, who wrote the book Up Solutions. I just can't see how it could get any better, so I'm honored to be a part of this. And I thought it was only fitting that I start the day with a quote from Patty. And Patty's quote from the 5-Day Biz, a class I took recently of hers, was this. She said, often the patient doesn't even know what to ask to make an effective decision. And I think when we're talking about the case of drug nutrient depletion, this is very relevant because I want to take this further. It's not the patient's job to know the side effects their medications are going to cause. They don't know what nutrients are going to be depleted. They don't know this drug might cause diarrhea or muscle aches or long-term problems like brain fog. It's on us as healthcare providers to offer that type of care. Okay, so I think we have to answer two things. Number one, is this market big enough for us to use our time and energy on? Is it big enough for us to use our technology like RMS provides on? And then number two, is it relevant enough to our customers? Do we have enough of our customers that this will matter to? Thus, is it customer centric? So I'm going to spend 2 or 3 slides and I'm going to try to answer that question. Now, right off the bat, I want to say 60% of prescription drugs cause side effects due to drug nutrient depletion. 60%. That's 60% of the prescription medications that you're already dispensing. I also want to remind you that the number one reason patients stop their prescription medication is still side effects. Cost is number 2. Okay, now this blows my mind. 68% of patients take supplements right now with no relevant recommendations from anybody. You know, there's another thing I like to say, 1 in 2 people take a multivitamin and they're just guessing. But 68% of your people believe in supplementation and they're just guessing. They're at the supermarket. They're getting some 18-year-old's opinion. They're in a chain and nobody's telling them which one they should take. Okay, now today I'm talking drug nutrient depletion, but I'm only talking 3 classes. I'm talking diabetes, high blood pressure, and high cholesterol. So let's see if that's relevant to your market. Well, 10% of the U.S. population has diabetes. 45% of the U.S. population has high blood pressure, and another 30% of the U.S. population has high cholesterol. Now, I realize there will be some crossover in these markets, but this could easily be 50% of the people who are already walking into your pharmacies right now. Okay? So I think clearly you already have a huge market And clearly we have an opportunity to solve a lot of patient problems. So now what I want to do is see, are these relevant to your pharmacy, and is it relevant to your customers? So the way I want to do that is I want to look at 2 disease states, and I want to start with the disease state of high blood pressure. Okay, and I want to say this, at Solutions RX, we don't believe in what I call the onesie-twosie method, where you pick one drug and try to match the supplement to it. We believe you treat drug nutrient depletion as disease state classes, and I'll get deeper into that as we go. But let's take a look here. Here's some common high blood pressure medications. You got the beta blockers, you got your atenolol, your bisoprolol, your Coreg, your low pressor, common drugs. You've also got your ACE inhibitors in your ARBs. I got benazepril, enalapril, lisinopril. I didn't list any ARBs, but they would fall in this category. Then you got your diuretics like Lasix, hydrochlorothiazide, diazide, cardiac glycosides cause some depletion like Lanoxin. And then look, we got the statins. Now, statins obviously are used to treat high cholesterol. However, a lot of the time, high blood pressure patients will be on statins. So we take the statins into consideration with our thought process of drug nutrient depletion with a high blood pressure patient. Now, all of these drugs can deplete the body of the common nutrients depleted. Now that can be coenzyme Q10, which we're going to look at deeper in a minute. That can cause aches, and not only aches, I think people think of that because it's a primary side effect, but I think of it as keeping your heart and mind healthy over a long time. Your Bs, B1, 5, 6, and 12, you just about can inhibit one B vitamin without inhibiting them all, because of the intrinsic factor in the stomach, and that leads to the Krebs cycle. Then you got zinc, calcium, magnesium, folic acid, vitamin D, and potassium, and all of these drugs depleting all of these nutrients lead to the most common side effects of the drugs. And short-term side effects, and when I'm talking short-term, I think of side effects that can present to our patient in a day or two to a week or two. Okay, short term. Then let's look at them. Decreased energy and fatigue, drowsiness, leg cramps, easy bruising. If you start to get some of these side effects, are you going to stay compliant to your medication? Are you going to stay on your medication? Probably not, right? Look at the last one, decreased immune response. You start taking zinc, folic acid, and D away from the body, your immune response is going to go down. In the COVID-19 pandemic, do you think decreased immune response is a big deal? Especially going into flu and pneumonia season like we are? That is relevant data to your patient, folks. And now, look, I'm talking short-term side effects right now, but at Solutions RX, we like to put a lot of emphasis on long-term side effects. And I think too often pharmacists look at long-term side effects as, that may or may not happen. That's way down the road. I don't have to think about that right now. Well, I want to change the way you think today. I want you to consider a short-term side effect as a primary side effect, and a long-term side effect as a secondary side effect that we could prevent. Okay? And I will say this, long-term side effects, once they present, they're very hard to reverse. However, if you work on preventing them, they're usually pretty easy to prevent. So let's take a look at some of these. You have memory loss and brain fog. And brain fog clinically is that, I can't remember, where did I put my keys? What's that person's name? I'm cloudy. That's brain fog. Clinically, memory loss is when you have segments of your memory that you can't recall. That's more like, hey, I was at Thanksgiving dinner. They're telling the story. My family said I was there. I was obviously having a good time, and I can't remember the moment. Now, tons of nutrient depletion, the Bs, the CoQ10 lead to memory loss and brain fog. The FDA does not make big pharma put precursor to Alzheimer's on the side effect profiles. As my pharmacist professional opinion, I do believe that memory loss and brain fog from nutrient depletion are precursors to Alzheimer's. And I think that's a big deal to your patients. Other long-term side effects, liver damage, slow wound healing, and decreased sex drive is a big deal to your patients, and they deserve to know. I know if I'm your patient and I've got decreased sex drive 12 months to 18 months down the road, and then I come in, And then you educate me, oh, yes, probably your medication. I'm a little aggravated by that. I wanted to know 6 to 18 months ago so I could do something about it then. Okay, so I think we're starting to see some patients that walk into your pharmacy. Now let's get really specific and let's talk about individual side effect. And that side effect is probably one you're very familiar with. It's called the statin A. And I want to point out that the statin A is a patient-derived word. It's a word to describe how the statins take away the CoQ10. I think people forget that statins also deplete folic acid and B vitamins. But the CoQ10 causes aches, and it generally causes the aches in the bigger muscles of the body, the biceps, the shoulders, the thighs. It's usually in the bigger muscles. And the ache can be so bad that I had a lady that wasn't a patient of mine stop me the other day, and she said, Chris, it feels like it's just eating my muscles away. Okay, so it can be a pretty bad ache. But what I want to do is I want to share with you a patient that was in my pharmacy. And I'm going to change his name to Bill. So Bill's in my pharmacy, and Bill was a man's man. Bill was a logger in the state of Mississippi, okay? And Bill was also low-income subsidy. He was dual eligible. He was Mississippi Medicaid and Medicare, so he's not a very wealthy patient. So Bill's in our pharmacy, and our pharmacist is going down to up solution Bill like we train our pharmacists to do, and we train pharmacies all over the country to do this. And as he's talking to Bill and showing him the possible side effects and things, Bill stops him and says, stop, young man, because our pharmacist didn't think he would buy the supplement. The supplement he was offering was $23.99. He didn't think Bill could afford it. And Bill said, hey, I'm having some of these problems right now. I want to try that. So our pharmacist got the bottle, he made the purchase, and he left. No big deal, right? What happened next is where it gets cool. About 5, 6, 7 days later, Bill walks back into the pharmacy. And when Bill walked into the pharmacy, you know, man's man, he looked at our pharmacy and said, hey, you, come here. So our pharmacist thought, oh my God, you know, we get that in the pharmacy, we probably made an error, right? So he's going down, he's thinking, what did I do? Did I put the wrong drug in the bottle? He gets down there to Bill, and Bill says, hey, young man, I wanted to come in here and tell you I work a hard job. I'm over 60 years old. I thought I had arthritis setting in. I thought that was causing my low energy and my pain. It never crossed my mind that my prescription medications could be causing my problem. Thank you. You see, what Bill came into the pharmacy that day to do was do one thing and one thing only, to tell our pharmacist one thing. Thank you for solving my problem. Folks, if that's not customer-centric care, I don't know what is, okay? All right, I want to go and I want to look at another disease state now. So let's look at another common disease state, diabetes, okay? And in the diabetes medications, again, we're trying to treat the class. So in Solutions Arts, we treat the class of drug nutrient depletion. So let's look. Do you have these drugs being dispensed at your pharmacy? So you got the sulfonylureas and second generation drugs like Amaryl, glipizide, glyburide. You got your biguanidines like metformin. Then you got your combo drugs, and they're combo like glucovance and Janumet. And don't forget, they're combo with metformin. Everybody knows that the #1 side effect of metformin is chronic diarrhea. It's not even classed as diarrhea anymore. It's chronic diarrhea. Then look here. When we treat diabetic patients, we have to take into consideration that the guidelines say that a diabetic will be on an ACE for kidney protection and a statin for liver protection. So we include the ACE inhibitors again, lisinopril, enalapril, ramipril, the whole 9 yards, and the statins as part of our thought process. We also put insulins on here. Insulins cause some depletion. Then you got your diuretics again, your Lasix, hydrochlorothiazide, triampherine again. And don't forget, in Solutions Rx, we train you how to circle these individual medications and make it very specific to your patient. Wouldn't it be cool if we worked with RMS down the road and we put that at the point of sale? Hey, I don't mean to let too many things away, but we'll talk about that later. So this class of medications depletes this class of nutrients. So let's look at them. You got your B2, 6, and 12. That gets a lot of energy. Now, the 12 leads to a lot of the diarrhea side effect of metformin because it interferes with the intrinsic factor, and that, again, leads to the Krebs cycle. You got CoQ10 that not only also sets those aches, but it keeps your heart and mind healthy. Folic acid, magnesium, chromium, vitamin C, zinc. Again, a lot of nutrients. That's why we don't believe in the onesie-twosie effect. Short-term side effects from this class. Again, chronic diarrhea, mainly caused by metformin. Fatigue and decreased energy. Muscle aches, very common. Not just from the CoQ10, but from the magnesium and other things. Frequent infection. Infection's already a problem for a diabetic, right? Nausea and decreased immune response, which again gets back into wound healing and COVID-19. Now, let's look again, primary side effects that'll happen pretty fast. Secondary side effects that could be coming down the road. Decreased libido. Again, you see brain fog and memory loss. Depression is actually fairly common for people who have nutrient depletion. And I really want you to look at these next three. Increased risk of heart disease, neuropathy, and vision problems. Now, I know those are all long-term complications of disease state diabetes itself. But think about this. If you're not treating the nutrient depletion caused by the drugs, quite honestly, you're probably speeding these up for your patient. And that's not problem-solving customer-centric care. If we treat the nutrient depletion, quite honestly, we can probably slow this down and maybe not even make it happen for the patient, okay? So now, I think this is relevant to your store. I think we showed a huge market. Now, let's talk specifically about a side effect again. This is another patient-derived side effect word, Metformin Blowout, okay? And what it means is when a patient has so much chronic diarrhea and it's so bad and so violent that sometimes they can't make it to the bathroom and they have blowout in their pants. Not being funny, this is a bad side effect. Or they have blowout when they get to the restroom because the diarrhea is so violent they could barely hold it. Okay, it's a big deal to patients. And I want to stop right here and I want to share another patient story with you. Okay, and I'm going to call this patient Kim. And Kim was not a patient of our pharmacies. Kim had a friend on our pharmacy staff, and our pharmacy staff's known for solving patients' problems, so she called the member of our staff. And she said, hey, I'm on metformin, and I'm having metformin blowout. Now, those were her words. So she had chosen to stop metformin and go on to an insulin injection. And the injection was $150 a month, and she had a copay card for $100, so it was costing her $50. Now, Kim was wealthy, okay? Now, so let's think about this, though. This side effect was so bad that Kim stopped an $8 to $10 medication to take a $50 a month medication and stopped an oral medication to inject herself. That's a customer-centric patient problem, right? What Kim wanted from us was not nutrient depletion discussion. She wanted us to find another copay card, right? She wanted the $100 back. So what we did was we educated Kim that if you just took our diabetes supplement, you could probably offset the metformin blowout and go back to the metformin in the cheaper option. When the Kim wasn't on board on first, right? She had metformin blowout so bad she went to injections. But what we talked her into doing was taking our supplement for a month and then easing back into the metformin. I'm happy to tell you she was able to ease back into the metformin, lower her healthcare costs, $150 or $50 a month, however you look at it, back down to the lower copay. Take a great multivitamin specifically for her, and we solved the patient problem. Again, if that's not customer-centric healthcare, I truly don't know what is. So let me get back to sharing my screen with you. And I want to tell you, we've talked a lot about healthcare from the patient aspect. I want to talk about healthcare a little bit now from the care side and the healthcare cost side, okay? So I think we've established we got a problem. What does this problem look like? Well, from the care side, the patient's gonna have side effects. And we already said the number one reason people stop their prescription medication was because of side effects, right? Now, also, if they're having side effects, you're gonna have suboptimal therapy. If the patient's not taking their medication, so they're not taking it on time, then we're not gonna get the care we're expecting at the pharmacy or the doctor's office or the hospital. Then readmittance goes up. If the patient's not taking their medications right, it's just a matter of time till they're back in the hospital. Then I should have probably called this compliance goes down, but when compliance goes down, when the patient doesn't take their medication, DIR fees go up. And we all know that's bad for our bottom line in the pharmacy, and it's bad healthcare. Now, let's look at it from a cost standpoint. Well, from the patient side, I just showed you a patient that went from a $10 drug to a $50 or $150 drug. I know you've all seen statin patients that quit taking their statin to go to a drug that's thousands of dollars a month, like Repatha. So the patient dollar goes up. What about the clinic? The clinic operates on a program called MIPS and MACRA that's very similar to the DIR fees the pharmacies have. And when patient compliance and readmittance when compliance goes down and readmittance goes up, then the clinic gets fined more dollars. What about the hospital? Well, readmittance is a buzzword for the hospital. As readmittance rate goes up, the hospitals have to pay more in fines and fees, and thus healthcare goes up. And last but not least, what about our pharmacies? As compliance goes down, DIR fees go up, and that costs the pharmacy more money. I'm going to look at profit, but just in the healthcare savings, just in the cost savings, think of the difference you can make. My pharmacy was rated against other pharmacies across the country in Metformin compliance, lisinopril compliance, statin compliance, MTM's closed, and let the minimal DIR fees lost against about 45 stores in the country. And we were ranked #1 in every category against all 45. Now, 2 to 45 was all over the place, but we were 1 in all the categories. And I think it's because we're so good at drug nutrient depletion and we're practicing such a high level of care that our patients actually take their medication correct. Now, we talked a lot about the problem. I want to talk a little bit about what is the right answer, or what is the solution to the problem, and why. Now, obviously, at Solutions RX, I think we are a part of the answer, because we train our pharmacy teams around the country. We give them the materials they need. But mainly, I think when you're talking drug nutrient depletion, you have to avoid the onesie-twosie approach. And I want to talk a little more about the onesie-twosie approach. And this is what the onesie-twosie approach looks like. You get somebody on a statin, you say, well, I've got to replace the CoQ10. Well, but there's some folic acid being taken out, and we need that to keep the heart healthy. So we're going to add that. Oh, wait, they're on something that depletes a B vitamin. And you can't deplete one B without depleting them all, so we need a B complex. That's what we need now. Oh, wait a minute. We really didn't cover everything. So let's just add a multivitamin. Or we need something for the immune system, so let's add some C. Having leg cramps. Now we need a calcium, a zinc, a magnesium to get those electrolytes back. This is the onesie-twosie approach. And I might add, these are crappy vitamins. These are not high-quality vitamins. And the onesie-twosie approach, it looks something like this. You've got a patient that's already on a difficult regimen. They've already got a disease state, and you add all this to the regimen. Do you think they're going to be compliant to that? Absolutely not. That's like all their nutrition from a handful of pills and vitamins. Also, you were trying to save money with the onesie-twosie approach, and this is the cheapest crap version. This is about $55, okay? Or you could have went with Solutions RX, and your high cholesterol patient could have taken this multivitamin that was formulated with all those depletions in mind. Or you're only on one of our multivitamins at a time. If you have high blood pressure and you're on statins, then you just take this multivitamin. And last but not least, if you're a diabetic patient, we cover the CoQ10 in statins because of our thought process, and you take this multivitamin. You see why the onesie-twosie approach does not work, all right? Now, not only onesie-twosie, you have to have high quality at a reasonable cost. They've got to be able to afford it, okay? And let's take a look and see what that looks like. Well, high quality to me means good manufacturing practices. So you get that seal. None of those have that seal. You got made in America. I think that's important. This was Pharmacist formulated by me and my staff members back in the day. We had biologists and chemists and other pharmacists involved. And we formulated this with the whole disease state in mind. Now, we have high quality chelated minerals. We have a B blend. Our B blend is way above the recommended daily allowances because somebody taking these drugs with these depletions need more than that. There's clinical studies out there that show that increased Bs help with brain fog. Increased Bs offset that diarrhea side effect, at least most of it. We've got some other things to help with that. Increased Bs definitely increase energy, and increased Bs also help with neuropathy. Bs are very important in drug nutrient depletion, and we think we've got the perfect blend. We've got the other minerals. Then we've got CoQ10, not just regular CoQ10. We have a crystal-free version of CoQ10. Most of the time, pharmacists put patients on such low-quality CoQ10 that they can't absorb it because the crystals are too big. Okay, and so they don't get the results they're looking for. We have a crystal-free CoQ10, and then we have a proprietary blend of enzymes, and the enzymes are in there to help you with the GI problems, to help you break down the minerals and absorb them the way the body needs. The body needs enzymes with multiple vitamins to have proper absorption. Okay, so I think that you have to have high quality, and I also think you have to have a reasonable cost. Well, our retail sales point is $23.99. And remember, patient one was low income, and he was a repeat buyer for years. Patient two was a wealthy patient. And I've got some pharmacies out there that sell our product for more than $23.99. Now, the product has to work. Well, I'm excited to tell you we've sold over 500,000 bottles in the 6 years we've been here. So I think it works pretty well. And our Solutions RX pharmacies, we're in over 500 independent pharmacies around the world. They are the ones making the recommendations for patients to take our products. And a lot of them are taking our vitamin and putting it in their sync program, and it's just a part of the process, so they're repeat sales. Is that cool? Is that customer-centric care? I think it is. Well, let's look at one more thing that me and Brad for sure agree on. You have to be profitable while you're offering high-level care. So I want to show you, you should have this downloaded. I'll share my screen one more time or stop. You should have this paper that you can download, the profit potential paper. If you don't have it, no worries. But if you do, you can follow along with your store. And what I want to say is that a store, and I plugged in 200 prescriptions a day. If you're doing 300 or 400, great, add your numbers. 5 days a week. If you're open 6 or 7, by all means, put it in. But a store doing 200 a day would have about 50 opportunities, and we multiplied by 25%. Yes, I told you the number for these three categories is about 50%, but let's just do 25. If they made 4 sales a day following our process, that means they got told no 9 out of 10 times they asked somebody. They'd make 4 sales a day. All our products have a $10 or more margin. In a 25-day month, in 12 months of the year, they could easily gross profit $12,000 from offering great customer-centric care. That's just for the first 10%, and that's actually if you're not that good at the process. Okay? If you got 2 out of 10 to try the product, then yes, you'd make $24,000. And I know some of you out there saying, hey, I'll get 50%. Yes, if you can get 50% of the market you already have, then you could easily make $40,000 or $50,000 just from diabetes, high blood pressure, and cholesterol drug nutrient depletion. Remember, 1 in 2 people are already on multivitamin. You don't have to convince them to take it. You have to educate them on why this is the best one for them. Now, this market has been around for 30 years, okay? So the question is, why do pharmacists fail in this market? Why have they failed over the course of time? Well, the reason, quite honestly, is they never identify the problem. Wouldn't it be great if the point of sale identified the problem? Well, that's what RMS is working on, and we're proud to work on that with them. And you know, the other thing is they don't identify the problem, then they go the onesie-twosie method, and then they don't have a multivitamin approach that's at a reasonable cost. You know, I showed you crap that was $55. Sometimes high quality in the onesie-twosie concept can get $90, $100, $150 a month, and people can't afford it. But folks, I really enjoyed being with you today. I want to say Solutions RX and RMS are going to be working together in the future. I'm excited to say I'm back next month to talk about a bigger market, which is probiotics. I hope I'm not letting the cat out of the bag. But you can find us at www.solutionsrx.com. Our phone number is 844-563-0095. If you're not practicing in drug nutrient depletion, we would love to have you. If you already have a drug nutrient depletion company, no worries. If you have any questions about anything I said, we'd love you to reach out. We would love to be your supplement company. If you've already got a company, we're in 15 other markets, so we'd love to talk to you about whatever you'd like to talk to us about. Other than that, I want to thank RMS. I want to thank Brad for this opportunity. And I like to close out like this every time I'm talking about Solutions RX, and it's simply this. Hey, everybody, solve your patients' problems. Thank you.